Imagine your body's immune system, designed to protect you, suddenly turning against you. This is the central phenomenon in Guillain-Barré Syndrome, a rare but potentially life-threatening condition that affects the nervous system. Today we'll explore its occurrence, symptoms, diagnosis, treatments, and ways to prevent it. Our nervous system controls nearly everything we do: movement, sensation, even breathing. The peripheral nervous system, which connects the brain and spinal cord to the rest of the body, plays a key role. Guillain-Barré Syndrome, or GBS, specifically targets this system. Although Guillain-Barré Syndrome is rare, its occurrence can be striking. It affects around 1 to 2 people per 100,000 each year globally. Its onset is sudden, and it can affect individuals of any age or background. However, it's slightly more common in adults and in males. So, what triggers GBS? It all begins with the immune system. Normally, it defends us against infections, but in the case of GBS, the body's defense mechanism mistakenly attacks the myelin, the protective covering around nerves. This damage disrupts the transmission of nerve signals, leading to weakness and paralysis. Infections are the most common triggers. Viruses like the flu, the Zika virus, and even bacterial infections like Campylobacter, which causes food poisoning, have been linked to GBS. While most people who have these infections recover without problems, a small percentage may develop Guillain-Barré Syndrome. The symptoms of Guillain-Barré Syndrome can be alarming. It often starts with mild symptoms, such as tingling or weakness in the legs, and can quickly progress to more serious issues. The key feature of GBS is the rapid onset of muscle weakness, which typically begins in the lower body and can ascend toward the upper body and respiratory muscles. GBS typically progresses in 3 stages. First, the onset, where symptoms develop quickly, usually over hours or days. Then, the plateau phase, where the symptoms stabilize. And finally, the recovery phase, which can take weeks, months, or even years. For some, complete recovery is possible, but others may experience lingering symptoms like fatigue or muscle weakness. Diagnosing GBS involves a combination of clinical examination and tests. Doctors look for signs of muscle weakness and sensory changes. One of the key diagnostic tools is a lumbar puncture, where fluid is taken from the spine to check for increased protein levels, a sign of nerve inflammation. Another common test is nerve conduction studies, which measure the speed of electrical signals in the nerves to identify any damage. While Guillain-Barré Syndrome is serious, there are treatments available that can help manage the condition. The 2 most common treatments are intravenous immunoglobulin, IVIG therapy, and plasma exchange, also called plasmapheresis. These treatments work by modifying the immune system's activity and reducing the damage to nerves. In severe cases, GBS can affect the muscles required for breathing, necessitating mechanical ventilation. Patients often require intensive care during the acute phase. After stabilization, rehabilitation is a crucial part of recovery. Physical therapy helps patients regain strength and mobility, and emotional support is just as important for mental well-being. When it comes to preventing Guillain-Barré Syndrome, there's no surefire way to avoid it. However, preventing the infections that can trigger it is key. Vaccinations against the flu and other infectious diseases can lower the risk of GBS. Additionally, good hygiene practices like frequent hand washing can help reduce the risk of infections that could lead to GBS. Although Guillain-Barré Syndrome can be a terrifying diagnosis, most people do recover with proper treatment. In fact, around 80% of patients recover completely or nearly completely within a year. The speed and extent of recovery vary depending on the severity of the condition, but early diagnosis and treatment make a significant difference. A strong support system plays a critical role in recovery. Family, friends, and healthcare teams work together to help patients rebuild strength, manage symptoms, and stay positive during the long road to recovery. Guillain-Barré Syndrome is rare, but its impact can be profound. By understanding its symptoms, diagnosis, and treatments, we can be better prepared to seek help early and support those who need it most. Thank you for watching.
If you like this video, please consider subscribing for more content like this.